Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadija, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness, so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Welcome back to Balanced Beauty Talks. Today's episode is all about herbal support for acne, how plant-based remedies can help calm inflammation, support detox, and bring your skin back into balance from within. If you're looking for a more natural approach to clearer skin, you'll love this one.
Awesome. So I think what we could start with is just talking about the liver, because a lot of the herbs that we use with acne and skin do have some sort of action on the liver. The liver is one of your biggest detoxification organs. Your skin is another one, but the liver kind of processes a lot of your hormones. It processes medications. It processes a lot of things for your body. And so herbs can really benefit the different phases of liver detoxification. And so especially with acne, because hormones play such a big role, we want to make sure we're targeting hormones separately, but also we're working on making sure you're detoxifying them properly. And when you look at something like estrogen detoxification, there's multiple steps to it. And a lot of it requires certain nutrients, but then herbs can support that. So one of my favorite herbs for liver support is actually Dandelion Root. It really helps stimulate that liver detoxification. It's really helpful for any inflammation. It also just helps the skin as well with inflammation in the skin. So often I'll find a supplement that has Dandelion Root in it, or I recommend people take it as a tea, specifically the root, because that's what has the action on the liver. But that's like a nice one to just help your body with lymphatic flow and with liver detoxification. And it's something you can have daily if you want to.
Another one, which you can do through food, specifically cruciferous vegetables, would be DIM or I3C. It's a really great supplement for helping the metabolization of estrogens. In a world where we're seeing a lot of estrogen dominance because of our exposure through cosmetics, through other environmental factors, through a lot of our foods as well, DIM can be really helpful in those who are dealing with estrogen dominance. Some great sources of cruciferous vegetables would include broccoli, kale, Brussels sprouts, cabbage, all of those types of family of vegetables are awesome. Turmeric is also a great option, and beets.
Yeah. Another common herb that is used for the liver is milk thistle. It works kind of similarly to dandelion root. It's a very gentle liver support. So that's a nice one. If you feel like people are very overloaded, that's like a nice gentle addition to a supplement routine or as a tea. And then something that's not a herb, more a nutrient, is NAC or N-acetylcysteine, which supports glutathione production. And glutathione is your master, your like gold standard antioxidant. So that's going to benefit your skin overall, but in general, it's going to help with detoxification.
And there's actually been some research around glutathione and those with acne. I will have to find this so I can quote it, but there's a very large percentage of those dealing with acne that are actually deficient in glutathione.
Okay. Lots of chatter about berberine. So how does berberine operate in the body when it comes to acne?
So berberine is actually a compound found in specific plants. So something like golden seal, Oregon grape, those are very common plants or herbs that are used for immune support. Or if you have a cold, if you ever have taken a cold tincture, it usually will have one of those. It's very like bitter. It's not a very good taste, but it's very, very strong for your immune system. And that's because of the berberine. The berberine has an antimicrobial action in the body. So that's kind of how we use it in acne, is because you have that bacterial production. It can target that target that bacteria and kill it off. And so I like to use it specifically for acne, but also for people who have like a candida overgrowth. Berberine is a common ingredient in a lot of antifungal formulations because it can work on killing off candida as well. Berberine gets a lot of attention because it can really regulate your blood sugars. So we use it a lot for people who have blood sugar dysregulation, which again can happen a lot with people who have acne. And so there is some research that's done on comparing berberine to metformin, which is a very common drug that's used in type 2 diabetes because it improves insulin sensitivity, which is the primary issue that's happening in type 2 diabetes. So berberine is used a lot around meals to kind of regulate blood sugars. So it's a really well-rounded supplement or compound, but those are kind of the main ways it's used for acne.
So probably good for somebody who has PCOS and acne too.
Yeah, definitely.
Totally. Yeah, it'll really help to suppress those sebaceous glands, which is very necessary with those with androgenic conditions. So another thing that it can be really helpful, it actually reduces proliferation. So that's the process where skin cells divide and multiply. So by reducing that, you're less likely to have congested, clogged, and acne-prone pores.
Yeah. Something though to note with berberine is it is a very potent compound. It is not a long-term supplement that you should be on. I usually put people on it for a short amount of time, then we reassess and then we take a break and we sometimes go back on it. Some people will rotate berberine, like they're not doing it every day. So this is one for sure you want to work with someone on just because it is quite strong. It's not the right fit for everybody. Okay, whenever we talk about acne, we do need to bring in the topic of hormones. There's a few different hormones that can play a role with acne. It's going to be very dependent on the person, but the main thing we see the most is high testosterone levels. We also see high estrogen levels or an inability to metabolize your estrogen appropriately, and then low progesterone or an imbalance between your estrogen and your progesterone. Something else that's not talked about as much is thyroid health too. That does fall under hormones, but lesser of an impact, I'd say, on acne. But so one herb that I like to use a lot is Vitex or chasteberry. It has a lot of different names. That one has kind of a direct impact on progesterone levels. So it can really boost or modulate that progesterone. So people who either have low progesterone or again, they have an imbalance between their estrogen and progesterone, that's a really nice one. People who have irregular cycles, Vitex is really nice to rebalance the cycle a little bit, especially you can take it throughout the cycle or you can just take it in the second half of your cycle because that's when progesterone is most dominant. So Vitex is a common one that I use, and you'll see it a lot in hormone formulations just because it really does work kind of holistically on hormones.
Well, it's not a herb. Inositol is a really great one for those with PCOS or PCOS acne. It can really help regulate blood sugar levels, reduce insulin resistance, and that is really the root cause of a lot of the PCOS acne that we see. So a really helpful supplement and quite life-changing for a lot of clients that we've had.
Yeah.
With PCOS, you want to work on the androgen levels. And so something like spearmint or saw palmetto, or both really, they both kind of help reduce the more potent version of testosterone in the body. So it's like a detoxification, but also really focusing on the androgen, which then will produce more oil in the skin. So yeah, both of those are really beneficial.
Another one is spearmint tea. Spearmint tea can be really helpful in reducing androgen levels naturally as well. So a cup or two a day can go a long way.
Yeah, that's a really easy and affordable way to kind of integrate that into your routine. And it's not there's not a lot of concern around doing something like that without knowing kind of where your hormone levels are.
Anyone can do that.
Yeah.
I really like, along the same lines, I like nettle, which is kind of similar to spearmint because it does have an action on androgen levels, but it's also very, very nutrient dense. So that's a nice one just in general for skin. I tend to put people on nettle tea often because it's so heavy in nutrients. So it's just beneficial in that way, but also with androgen metabolism.
It can be really calming to the skin as well. So really great for those with rosacea. Yeah.
Are nettles something that you would take orally in a supplement, or is that coming from tea? Like, what is the source of nettle?
But I mean, I really love it in a tea because you do absorb it very nicely. In a tea, those nutrients can really be extracted well, but it's commonly put in supplements at a higher dose too.
Again, it's like really important to look at people's digestive health. If
Yeah.
they're struggling digestively and we're trying to repair their gut, then tea or any liquid form of any of these nutrients and vitamins can be extremely beneficial because you're bypassing a lot of the digestive process. So
Yeah.
And I like to get back to the roots of how to take these medicines, because herbs are medicine. And so we didn't have supplement forms of these things a long time ago. We had them in their whole form, and we kind of learned how to extract these properties over time. And so when we know that we can extract these properties through tea, for example, or hot water, or there's certain ways, there's like a decoction. So certain herbs that are more roots, they're like harder to extract. They need a different process of extraction. So it's just nice to, if you can get patients back to that and bring in the ritual of making their medicine, I feel like the effect of it is a lot stronger than a supplement.
I think there's something to be said too for just the process of making your tea, sitting down, being present with it, enjoying it, whether it's in a bath or just quiet time to yourself. That goes a long way just in itself with your nervous system and the state that you need to have your body in order to heal whatever it is that you're trying to heal. So
yeah, exactly.
So to kind of strip it back a little bit, if someone thinks that hormones might be at play with their acne, what are some of the ways that they can kind of find out which hormones are at play or what's happening with their hormone levels?
Go ahead.
Well, first and foremost, the simple way that you can do that won't cost you anything is to start journaling and keeping track of your symptoms and your cycle and really knowing, is it regular? Am I getting my period at the same time every month? And what symptoms are showing up when? So just from like a really simple way to do it at home to starting today, that would be one way that you could start to play around. Second would be through Dutch testing, which is a really comprehensive hormone test that really not only tests the hormone levels and where they're at, but how your body is actually methylating and detoxing those hormones. So you can really see how well your body is detoxing everything.
So could it be as simple as like maybe those hormone levels are within normal range, but you're not methylating them well?
Yeah.
That could be a trigger.
Totally.
So that kind of like, I think that kind of leads to like when we see patients come in or clients that come in and they've done hormone testing through their doctor, through a blood test, and they seem to be within normal range. This is one of the differences with doing something like a Dutch test that can really identify maybe it is the hormones are within range, but the methylation is not.
Yeah, methylation enzymes too, because you require certain enzymes to break down each hormone. And so the Dutch can really lay it out for you, and you can see where certain enzymes are working in multiple pathways. So if you see certain metabolites of estrogen, for example, are low in two different places and it's the same enzyme, that tells you a lot about what's happening there. And something to say about with serum testing or blood testing is it's still really beneficial to get basic blood work with your hormones, but timing really matters when you're looking at hormones. So if you just run a huge panel and you test your estrogen, your testosterone, your progesterone, and your ovulatory hormones, FSH and LH, those are usually what's run when you're considering something like PCOS or just some sort of hormone imbalance. You need to take account for when those are the highest. So you want your ovulation hormones to be tested around day 3 or earlier in your cycle, and you want estrogen, progesterone, testosterone to be tested in the second half of your cycle. So a lot of the time people bring in their blood work and they had it all done on one day, but we can't really use that because it doesn't give us a good idea, because your estrogen, for example, might not have been at its highest point when you tested that. So same with progesterone, especially with progesterone, because it's only elevated in the second half of your cycle. So timing is really important. But overall, the Dutch test is more beneficial because you get those metabolites. And by the time some sort of dysfunction or imbalance hits your blood levels, it can be pretty far gone at that point. And so the Dutch can catch things a little bit earlier and give us a clue. Also, maybe we need to check your thyroid a little bit deeper. Maybe we need to look in your cortisol a little bit more. What other blood tests could we run? The Dutch can really direct you a little bit more.
Yeah, it's a really nice full picture of everything.
With the Dutch test also, it looks at your cortisol levels, and there's different panels that can test it more in depth. But cortisol is really, really important to look at because it kind of is like the master hormone. It can really insert itself into different places within hormone pathways. And so if your cortisol is off, then oftentimes you'll see these other like downstream effects of it. So that's why I really like the Dutch panel, because it breaks it down a little bit more deeper than you can get with serum testing. So that's just something to keep in mind. That's probably something we would need to dive into in another episode, because there's a lot to say about cortisol and thyroid and all the other hormones that don't get talked about as much, adrenal health. But that's the benefit of the Dutch test.
And with cortisol too, it can really mimic androgen or testosterone in the same way. So while people think, oh, I must have really high testosterone, it sometimes is not the case. And it's really just a cortisol issue. So
yeah. Mm-hmm. Something to keep in mind with all the suggestions and things that we've talked about today is that everything is very individualized, and some of these supplements, these herbs, may not work for you. It's really important to have testing done, to work with someone and make sure that whatever you're using, especially when it comes to hormones, because once you start moving hormones around, you could have something that's really low, but you're treating it as it's high. So you really want to get a good idea of what's going on before you start dosing yourself with some of these herbs.
Okay, we hope you have some takeaways from this episode. One thing we are really proud of here at Natology is the fact that we are very integrative in our approach to skincare. We do offer naturopathic services with Dr. Khadija. There's lots of nutritional support. We can recommend supplementation, and we do offer virtual consults. Yeah, so if you're interested in looking at full picture skincare, we'd love to support you in the process. And we're going to just transition here right into our Ask an SD. So the question we were asked today was, how do I know if I need a facial or something more advanced like microneedling?
Yeah, I mean, I think both. My preference is to always start with a facial. I think just understanding your patient and their skin health and kind of meeting them where they're at. There's a lot of studies that have been done too, showing that integrating a vitamin C in your daytime routine and a retinol in your evening routine can really stimulate up to about 400% more collagen and elastin. So just those are the little simple tricks that we can kind of do to trick the skin into enhancing the results of a treatment. So things like that, and just making sure that your skin health is in a place where you're going to heal well from microneedling. So microneedling is also called collagen induction therapy. Really beneficial for someone who wants to be preventative. So we say one of those treatments is equivalent to approximately as much collagen as we lose in a year after about the age of 25. When we move beyond one treatment and we move into like a series of 3, let's just say, that's when we're getting a little bit more corrective with the skin. So if things like texture, fine lines and wrinkles, discoloration, scarring, mild to moderate scarring are a concern for you, the microneedling could be a really great addition. So yeah, my answer is kind of both, but if you're new to skincare and you haven't really been in the routine or a cycle with doing regular facials, and if you're not using medical grade skincare at home, or you're not in a really great skincare routine, I would probably start with a facial or a consultation. That will help us direct you and then get your skin prepared for something like microneedling so you heal well and you are seeing better results.
I agree. Okay, well, that's it for today, guys. Thank you for tuning in, and we'll see you next time.
Bye.
Bye.